Hello everyone. In the previous post we asked you what the diagnosis for this case is. If you can see on your screen clearly that we have labeled two areas on either side which appear more or less bilaterally symmetrical, and if we look carefully there is basically this triangular shaped radio opacity that is clearly seen on the iliac side of the sacroiliac joints. So what do you think this structure here is, or rather what is the condition or the diagnosis here? So we were basically dealing with a patient who is around 30 years old and is basically a young female, and who was basically undergoing this investigation for some other reason, but we found this as an incidental finding. So the answer is, which many of you have correctly answered, is Osteitis condensans ilii. So what is it? So it's basically an isolated sacroiliac arthropathy, even though whether it's an arthropathy or not is actually something controversial, and it is commonly described as subchondral sclerosis of bilateral iliac blades near the SI joint. So the iliac blades are involved and there is subchondral sclerosis which is seen as radio opacity. Epidemiologically, it is classically described for women of childbearing age. So basically we are dealing with a multiparous female who is classically in between this age range, 20 and 40 years. And our patient was in this range, she was 30 years old. So if we talk about the pathophysiology, then there are hormonal as well as there are mechanical factors that are involved for the development of this condition. So first of all, whenever there is pregnancy or with every menstrual cycle, there is ligamentous laxity, especially the pelvic ligaments, which leads to hypermobility of the SI joint, and hence there is altered mechanics and friction which leads to sclerosis of the subchondral bone of bilateral ilii near the SI joint. That is because the iliac articular cartilage is 2 to 3 times thinner than that of the sacrum. If we talk about the radiographic features, then on plain radiograph we have already labeled this is how it looks. If you want to see carefully, I'll again erase the markings that we had done in the beginning of this video. So you can clearly see here how we can see these bilaterally symmetrical triangular radio opacities on either side of the SI joint, and basically it's towards the iliac side only. So the sclerosis of bilateral iliac blade should be, first of all, it should be bilaterally symmetrical, and it should predominantly involve the iliac blades only with relative sparing of the sacrum. Subchondral bone will be seen near the SI joint. It's classically triangular, which is why it is also called hyperostosis triangularis ilii, and usually it involves the lower third of the iliac blades because that is the part of the SI joint which is basically synovial and has maximum movement, and it is best visualized by a tilt up view, which is basically done by a 30-degree cephalad angulation of the tube. If we talk about MRI, this is the MRI of the same patient whose X-ray we saw, and what we can clearly see here is on T2 wetted image you can clearly see how there is hypo intensity in this triangular fashion on either side of the SI joint towards the iliac side only, with relative sparing of the sacral part of the SI joint. Even in the star images you can clearly see how there is hypo intensity, and hence this is basically something like sclerosis that we are dealing with. So on T1, T2 and star, in all these sequences we will get hypo-intense triangular bilaterally symmetrical areas in subchondral location of iliac blades near the SI joint, and there is no evidence of joint space narrowing and there is no erosion. This is an important negative point because these are the things that we are going to find in the closest differential of this condition. So the closest differential or the major differential is inflammatory sacroiliitis, which is easily differentiated on MRI. If we look on MRI on T2 and star images, if we see that there is hyper intensity, then basically there is inflammation, there is edema, you are basically dealing with sacroiliitis. And if it is hypo intense on all sequences, then you're basically dealing with Osteitis, Condensans, Ilii. So for differentiation of plane radiograph, this is what you need to know. So you need to look for SI joint space. If you think that the SI joint space is normal, then you are basically dealing with Osteitis, Condensans, Ilii, which is quite a benign or a quite harmless condition. And if there is a pseudo widening, as is seen in the initial stages of sacroiliitis, later on if there is narrowing, and if in advanced sacroiliitis you see ankylosis, and of course if you find erosions, then you are basically dealing with sacroiliitis. Just for a comparative study, you can see clearly here that we are looking at a radiograph in AP view of the lumbosacral vertebra and the pelvis, where you can clearly see these structures here. These are basically syndesmophytes, as you can see here as well. And if we look at the SI joint on either side, you can easily see that there is no possibility of delineating the SI joint space, because the space has been absolutely obliterated and there is complete ankylosis of bilateral SI joints. Quite contrary to this, if we look at another representative image of Osteitis, Condensans, Ilii, you can clearly see, if I zoom it here for you, you can clearly see how this joint space is very nicely maintained, and there is this triangular shaped sclerosis or radio opacity as we see on the radiograph only on the iliac side of the sacroiliac joint. So basically the answer is Osteitis, Condensans, Ilii. Now it's time to mention the names of those who answered the question correctly. So we are looking at the comment section of the main post on Facebook of our Facebook page, and we can see Iman Hamid, yes, you are right, it's Osteitis, Condensans, Ilii. Shreya Bhatt is also correct. Utpala Chandradasa, Muhammad Bayumi El Bakir, yes, you are right, it's Osteitis, Condensans, Ilii. Sahira Khan is also right. Partho Hazarika, yes, your answer is correct. It's not sacroiliitis. Kadir Benachir, yes, you are right. It's Osteitis, Condensans, Ilii. Mbangenang also has correctly answered. It's Osteitis, Condensans, Ilii. Unsal Koskun, you're right. And Radiology Learner. So all of these people have given the correct answer. And on our Instagram page, the correct answer has been given by Dr. X Vision. It's Osteitis, Condensans, Ilii. So these are the people who answered the question correctly. Congratulations and kudos to you.